Welcome to the Calm Cockpit, where pilots of all levels can find high-performance tools, actionable strategies, and access to professionals who can help you fly smarter and stress less.
Today, we're joined by Beth Wagner, a doctor of physical therapy and vestibular rehab specialist, to talk about how pilots can apply the principle of preventative maintenance to our physical and mental training routines.
With Dr. Wagner, we'll explore motion sickness, surviving long flights without back and hip pain, and how to optimize our routines to support the mental clarity needed for high workload environments. Dr. Wagner will offer science-backed strategies pilots can integrate immediately both in and out of the cockpit.
We'll also cover vestibular system basics and exercises designed to help manage the effects of spatial disorientation and motion sensitivity.
The Calm Cockpit podcast starts now.
Onyx 1-2 Mike Oscar, runway 27, clear for takeoff.
Dearest listeners, I am so excited to introduce you to Beth in a few minutes. To set the stage for today's episode, John and I are going to cover a little bit of the backstory on how Beth came to be on the show today, give you, of course, her bio, and then you'll hear this really robust interview with her. At the end of the show, John and I will meet you back here to talk a little bit about how you can start implementing Beth's takeaways right into your routine right away. And I'm going to also cover the specific protocol that I used and continue to use to help me manage any motion sensitivity and also to start training for unusual attitudes. So John, could you please tell us a little bit about Beth's official fancy bio?
Of course. So Beth earned a doctorate in physical therapy from the University of Washington and a bachelor's degree in psychology from the University of Puget Sound. She also has a certificate of competency in vestibular rehabilitation and is certified in mechanical diagnosis and therapy. She hosts a wonderful YouTube channel with over 100,000 subscribers with videos on foam rollers, spinal alignments, body scan relaxation, progressive muscle relaxation, eye massage review, posture exercises for driving, and so many videos for rehab after all kinds of surgeries.
It is an extremely robust channel, and of course, you can find the link for her channel in the show notes. And this is actually how I met Beth. In my early days of primary training, I was still a really nervous flyer, and I also had this, I would say, overwhelming irrational fear that I was going to become sick during flying. I never actually did or have, but I was so afraid of it that it was getting in my way. So in my work as a therapeutic yoga instructor, I knew that neuroplasticity, my ability to learn new things, could come into play with this to help me overcome this. But I knew in order to do that, especially at midlife, I was going to have to do a lot of exposure to not only flying, but do as much as I could on the ground to help make my motor planning and my vestibular system robust. Because honestly, as a midlifer, I spent a lot of time sitting. Sure, I do inversions because I'm a yogi, but I'm not doing a lot of things where I'm tipped to the side and moving forward and backwards in all different ways. So I really needed to kind of challenge my body in different ways. And at the time, I came across this quote, an interview rather, with one of the most famous pilots of all times, Bob Hoover. And it really started to shift the mental game for me a little bit and gave me insight into that I needed to find someone like Beth to help me with this. So Kathleen Bangs published this in the AOPA online. I will link to this. And she just said that she was at, I forget what it was, some convention or something, and she happened to see Bob Hoover. And so she ran over to him with a microphone and a tape recorder and asked him a bunch of questions. And I'm so glad that they published this interview because listen to what he says. Her question was, who was the most particularly influential flight instructor for you? Bob said, quote, "I'm a rarity. Nobody could teach me. I got sick every time I got in an airplane because of air sickness, but I kept at it until I could get over it. I was sick, swallowing it over and over, but I was so motivated I would not let it stop me. I was determined in my mindset, and I conquered unusual attitudes one step at a time until I could handle that without becoming ill." And he goes on to say that he flew a lot and he would just basically take him to the point of what he could handle and then every day push it farther and farther. But hey, if you're a midlife pilot like me, I can't fly every day. I don't have the money and the plane isn't available every day. So in my quest to educate myself, I came across Beth's YouTube channel. I knew that vestibular system had a lot to do with motion sensitivity and my ability to make sense of where I was in space. And because I had a fear of flying and I wasn't in the air a lot, that there might be a cool way to sort of augment my training. So I found one of her videos. You'll hear us talk about it in the actual interview. Now it has something like 500,000 views. Like amazing. It's a beginner's vestibular rehab video. And I basically expand upon it with my own creativity. I eventually reached out to her and said, hey, can you just do a private educational consult with me via Zoom? Because she's in Hawaii. And I wasn't going to fly to Hawaii, even though that'd be great. And I just said, I just want to learn. I'm going to be doing, unusual attitudes training someday. I'd love to do a little aerobatic stuff sometime, but I know I'm going to need to do things on the ground. And we just came up with all these creative ways that I could really mimic as close as I could on the ground with getting my body in as many different planes of motion. And I just loved her so much and found her just to be this font of wisdom. I asked her to please come on the show. So I'm so excited for you to hear this interview. But beyond the vestibular stuff, John, she's going to tell us about some other goodies too.
There's also a good discussion about how to keep your back happy in the cramped cockpits, which I know so well. Lifestyle recommendations, best type of exercises for pilots, how hydration plays a role in all of this, and so much more. Just lots of great advice, great things you can put into practice now to make that next flight just a little bit more comfortable.
So on to the interview with Beth. Aloha, Beth. Welcome to the Calm Cockpit.
Hello, Gita. Thank you for having me.
So great to have you here. I've benefited so much from your work personally. And one of the things I want to make sure we highlight right off the bat is your amazing YouTube channel, which is actually how I found you. Because as a newbie pilot, I was, very concerned about getting motion sick and motion sensitivity and all this drama that I had built up in my head about it. And I came across your video, which I just looked up today. It's called Beginner Vestibular Rehab. Woman, this thing has 470,000 views. That's amazing. But I don't believe that you designed to be this physical therapist on YouTube. Can you just tell us a little bit about how that part of your work has put you more into the public spotlight? Like when, why, how, and where did you start this YouTube channel?
Yes. So I started the YouTube channel in 2020, as I think many of us in that summer were trying to be creative and think outside the box. Mm-hmm. And so in light of the difficulty providing in-person care, husband, who is a photographer, videographer, he suggested, hey, let's start a YouTube channel. And so in starting that, I wanted to put out 10 videos covering a variety of topics. And it may have been within that first group of 10 or in the next couple. I did one on vestibular rehabilitation. For myself, it's one of the areas that I've always really enjoyed in my clinical practice because not all physical therapists are very comfortable treating vertigo and vestibular dysfunction, and I really enjoy it. So I recognize that there is not a lot of information available to the public. And so I wanted to put a video out. And at the time I thought, well, this is so out there and it'll probably get 10 views, but I'm passionate about it. I enjoy it. I think it's important. And I was shocked at the response. And the views are racking up and people are asking questions. And I was very astounded. And so based on that, I actually pursued certification in vestibular rehabilitation so that I could answer questions better, so that I could continue the series of vestibular rehab videos. And so over the next 6 months or so, I was certified in vestibular rehab and continued to put more videos out there. So as it stands, of the 200 and some videos on my channel, the beginner vestibular video has the most views by far, which I find...
You've gone viral. You've gone totally viral. Just admit it. You're there. You know what's so cool about it though, because it's not like I had any issues for me personally with my vestibular system, but I recognized in doing those exercises that I was helping myself desensitize to all kinds of different motion. We're going to talk about spatial disorientation for pilots a bit later on, but I recognized, wow, I can really take these basic exercises and make them even more challenging and make them harder and challenge my vestibular system when I'm just sitting on the ground to get used to more input than it would get in my normal everyday middle-aged lady life. So much so that I've shared it with a lot of people who have a fear of flying, because for a lot of them, it's the lack of being able to see forward and the lack of being able to make sense out of what's happening while they're in the cabin of the airplane that triggers a lot of the fear. And so by kind of stimulating their vestibular system and doing your exercises, it's a really unique way to train the body and mind. And it's kind of why one of the reasons I'm asking this is to not only point pilots at your great YouTube channel, but to also kind of point out that very often we wait until there is something wrong with us to then fix it. And then we go, Beth, I have vertigo, or I have frozen shoulder. And then we come limping into you and say, fix us. So I would love to know from your perspective as a doctor of physical therapy, if you had, a group of pilots listening on a podcast and you could say, hey, here are the things that I see over and over people doing that if you addressed ahead of time could stem off a lot of issues for you, particularly as you age. Are there certain things that you see or things we should be doing to help our everyday life? I know you got some.
Absolutely. I think ultimately the answer to that is highly individual, of course. Everyone has their own bucket of things, of stressors, of things going on in their life and variables that come together that could impact or could drive areas of prevention and areas of wellness and health to get ahead of dealing with dysfunction or, responding to issues. But with that said, I think in the general aging professional population, and I imagine pilots have some consistent stressors, common stressors in terms of stressors to their vision, to their neck and back because of the positioning and the seats involved in flying and the long days, interrupted sleep. So from that standpoint, or sort of assuming those commonalities, I think addressing posture, addressing neck and back health are really key. And there are many different ways of doing that, but definitely addressing vision. So beyond getting regular eye exams, I think doing some of the eye exercises that you just mentioned can be really helpful. And they're helpful for not only keeping ahead of things that could be going on, but addressing things before they can become problematic. So when you do things like gaze stabilization exercises, some of the other exercises in my video, it gives you some information about how you're doing. And I know you and I talked about that as a check-in. So in other areas of our health, for example, when we brush your teeth and you have some tooth sensitivity, it may bring your awareness to, hey, maybe something's going on with my teeth. So doing vestibular exercises as maintenance can be really helpful to alert you to some things going on. So you may notice changes day by day, week by week. Pilots may notice changes in how things feel in their system based on any number of factors. The type, maybe the type of plane they're in or the type of seat, the number of hours they're flying, the number of days their sleep is interrupted. Those could be some variables that then may derive some further action, some further interventions, perhaps something to either change or at least be aware of if change isn't possible.
I love that idea of doing the vestibular exercises as maintenance. Because if you don't know what your baseline is before things go haywire, you have to sometimes get like a big, huge red flag before you do anything to change it. Whereas even for my aging eyes, I'm 53 now. And because I've been doing eye exercises for, I think, 25 years now, I started to notice that as I was aging, my right eye is getting more weak than my left eye. So I'm able to address that in my everyday practice by covering up the left eye and working the right eye more. Whereas I don't think I would have really noticed it had I not been doing these discrete eye exercises. There's just too much visual information coming in all day long and my brain would compensate and I might not even notice. So I love this idea of doing vestibular exercises as maintenance. What about posture? Okay, like what does that even mean? Because usually if you say posture to someone, they like sit up straight like a ramrod and they introduce all this tension in their body and like who wants to sit like that? So then they just slump down again. Like
my posture's terrible.
But see, most people don't even know how to address that. So what do you mean when you say posture and what kinds of things can we do to help that?
Yes, and that is also different, of course, for everybody based on their history, their body type. In general, what I suggest is when most people, as you mentioned, think of posture, they think of being ramrod straight, and that's too much tension. What I suggest is if you think of like military posture, that perfect posture, Find that and then relax about 10%. And for many people, that's about what would be balanced. So that end range perfect posture is too much for most people. And maybe some in the pilot community who have the military background have spent some time in that military posture. If you take about 10% off of that, then that allows enough room for your skeleton and for the postural muscles to have a little bit of wiggle room. So they aren't at their end range. They aren't in that position of stress and strain. There's a little bit of room to move. I think that's also important in the pilot community, well, in any community, but also to allow for some environmental movement. If we're at our end range, it doesn't give us room to move any farther in particular directions. And in a plane, there's vibration, there's constant movement. So if you're trying to hold your back up against a wall, then experience that movement, it's not going to last. And that is not what would be healthy for the body. So by relaxing about 10%, that's going to allow that little wiggle room. And it generally is a bit easier to maintain as opposed to going from our fully slouched, relaxed posture into this extreme end range posture and then back. So for a lot of people too, it's a matter of playing with kind of that mid-range. So that full posture minus 10% and then play with it and see what works and feels good. And then from there, doing the best a person can do to adjust the ergonomics of the situation. So if that's the airplane seat, the height where the lumbar support is, the position relative to the instruments. I imagine there's some control. I don't know how much, though, any individual can really fit the seat to fit their body. So that might not be really realistic.
Now, I want to come back to the seat, but before we do that, as Gita and the audience probably knows, I do love a good shortcut. And so when we're talking about posture, is there a technique or something that can help you pick that, like you said, the straight up and down, relax 10%? Is there a way to help you hold that? I have actually noticed in the past that in pictures, I've got a little bit of the tech shoulder with the neck that comes forward. And I've really tried to kind of fix that as best I can. And I've gotten a few things. I've got these like shoulder straps that you can wear for 20 minutes a day and it pulls your shoulders back. And this weird like blue pillow thing that looks like a tidal wave that you lay on and it's supposed to help kind of fix your neck. Do those things work? Are there better techniques? Like what can we do to shortcut this?
Oh,
Great
John.
Yeah.
John's
That's
always
great.
with the gizmos and the gadgets, always.
It's such a real question, though. It really, really is. And I love a good shortcut, too. My patients and clients know I'm also a 2-for-1 person. If I'm going to spend time doing something, I want to get the most bang for the buck.
I love it. Twofer.
Yes, I think the gizmos and gadgets, it depends. The two things that you mentioned, the strap that holds posture, can be helpful as long as it's used as a cue and not a crutch. Meaning if you use it for some tactile stimulation to remind you of where your midline or where your neutral is, then it's a great tool. If you use it to hang on, then no, it's really not going to help. The kind of wave, there are lots of different ones of those that you can lie on. There are some just for the neck, some for the whole body. I would say it's important to get one that really fits your curves to start with. And then, yes, that can be very helpful. Again, as long as it's a cue, it's a way to check in and reset and not something that you rely on, because spending a few minutes or even 20 or 30 minutes on that is not going to completely make up for spending hours sitting in poor posture. So I think that's part of the process. The other part that there really is not a shortcut for is overall exercise and maintenance of muscle balance. So for those kind of tech shoulders, forward head, rounded shoulders, it is a matter of opening up the chest. So doing exercises and movements like doorway pec stretches that really open up the chest. It is remembering to do little chin tucks, cervical retraction, pulling the head back to get out of forward head posture. It is taking breaks from long sessions of typing, looking down in order to reset. So yes and no on the shortcut.
Right. To get back to the seats, yeah, the seats in most airplanes, especially the larger ones, I mean, they look nice and comfy. A lot of times they have sort of the Sherpa lined seats. They look just soft and fluffy. After 1,000 hours of butt in that seat, there's not enough cushioning in the world that can make that comfortable. And they are getting a little bit better in terms of the adjustment for lumbar support, or even, I don't know what it's called, but when you can raise the front of the seat so you relieve pressure on your legs. But I mean, that is definitely one of the major issues, is when you're sitting in an airplane for, generally my cutoff is about 4 hours, you end up needing to bring an extra cushion just so that you just don't find yourself in pain for the duration of the flight.
Yeah, I could only imagine. Are there opportunities within that time when, I don't know if it means when autopilot is on, that you can at least sit up, at least kind of open up an arm? I mean, is there space in that cockpit to stretch out at all, or is it pretty snug?
It's airplane dependent. I know in the one that I fly, you can kind of bring the seat back and you can push the pedals forward to give yourself a little bit of space, assuming somebody is prepared to fly the airplane if something were to happen. So, generally if one of us is going to do that, we're going to let the other person know that, like, hey, I'm going to let you have controls for the moment. But I mean, luckily we're also in a situation where on those longer flights, a lot of times we can even stand up and stretch if we need to, and take a few minutes to just kind of be standing. But yeah, I mean, any tips or techniques to make that more tolerable, I think, is certainly something that would be appreciated by the pilot community.
Yeah, I think the three areas, again, this would be individual dependent, but the three areas that I could see being most helpful would be certainly to straighten the hips. So as you mentioned, being able to actually stand up and be fully erect. So be able to get your legs underneath you and get out of that 90-degree hip flexion angle sitting. That would be one. The second would be at the shoulders, to be able to pull the shoulder blades back. So squeezing the shoulder blades in the back, pulling the shoulders back, reaching out with the arms if possible. And then the third would be the head position. So bringing the chin back. It's called cervical retraction. Many times when you say chin tuck, people think you mean bringing your chin to your chest, but more what I mean is straight back. One way I describe it is thinking of getting pied in the face. So you're wanting to bring your head straight back. Giving yourself a double chin.
Oh, yes, what every woman wants to do. Give me a double chin there. There we go. What does that do for posture? Tell me what's happening there. That's getting rid of the slumping forward? It
helps to realign the spine. So if you look from the side, most of the time when people have a forward head, it's because their whole head is in front of their body, as opposed to tipping up or down. It's more of forward head. So by bringing it back, it helps to realign, stack the spine better. Now, depending on your seat, one thing in a car, what I recommend to people just to check in with themselves is that in proper alignment, the back of your head, the middle of the back of your head should be pretty close, within about an inch or so of your headrest. Most of the time when we're driving, you end up way forward and your head is a foot forward of that headrest. So if you have to go way, way, way back to find the headrest, then you're sitting too far forward. But I don't know if that's really accurate in an airplane seat. It
probably is. And part of the thing is that just like looking at your cell phone or looking at a computer screen, I mean, my airplane has 4 computer screens in front of me, not even talking about the 4 like tablet looking things that are also in front of me. And so you end up kind of in that same boat where you're leaning forward to look at this screen because that's your natural reaction to looking at a computer-esque type screen.
Yes. Yep. That makes sense. And I get it that that's also kind of a constant battle, and just taking those breaks as often as you can. And if that means working with your co-pilot on kind of a structured break agreement of, okay, every hour or so or every 30 minutes, we're each going to take 5 minutes to reset.
I love those 3 keys of resetting. If I heard them right, they are, you want to get your legs extended. So get your hips out of that 90-degree angle, get that pressure off the lumbar vertebrae and especially the blood flow and all of that, then opening up the chest and arms, and then bringing the chin back like you're getting a pie in the face, which is a great cue. I will never forget that. But those things, it's a physical reset that I can imagine is going to lead to also more focus, more mental clarity. You're getting increased oxygenation to all the tissues. I mean, it's one of those things where you're changing the alignment of the body, which then in turn will change your alertness. It just seems like if there's a way we can do that in every cockpit every 25 or 30 minutes, that's a huge asset. Yeah.
Yes, absolutely. And you're right. Physiologically, there are several components to that. One is simply avoiding pain. Pain is distracting. So avoiding pain is very helpful, of course. The second is neurological connectivity. So maintaining a healthy spine and spinal cord all the way from the lumbar spine through the thoracic spine and the mid-back, through the neck and up into the head and brain. And so opening up the hips helps with that to maintain kind of fluidity in the lumbar spine, and then opening up the chest improves breathing as well. So when the chest is caved in, it's harder to breathe. There's just a tendency to breathe more shallow. And somebody can survive obviously just fine doing that for hours and hours and hours, but it's not optimal. So opening the chest to allow better oxygenation throughout all of the tissues, including the brain, is helpful. And then absolutely correcting the posture in the neck. It frees up any pinching of nerves that can be happening through the neck, through the base of the skull. And that will also help with speed, connectivity, and the optimal functioning of the nervous system and focus, concentration, sharpness, reaction time.
Will that help with, because one of the other major things that a lot of pilots will deal with is like blood clots, especially in the legs. Will those techniques help with sort of the tendency to, or the ability to maybe avoid some of the conditions that causes?
Yes. Getting up, standing, walking around definitely will. The other thing is just simply moving the legs, bending the ankles and the knees. So if your foot's on the rudder or on some controls, then obviously you have to time that, I would imagine, for sleep.
Hang on, everybody. I'm going to exercise my legs.
Yeah. I got to prevent blood clots. Hold on. Yeah, exactly. So within however that works, yes, you're right. So that's a fourth area. I would add a fourth area to that idea of movement, and that is to move the legs, bend the ankles up and down, bend the knees in and out, and get up and walk when you can.
It's like a little movement reset. And I know John's talking professional pilots and big fancy plane that you can get up and walk around in. Like, I don't have that luxury. I'm in an old beater. It's like no offense to my plane. She's not a beater, but she's, a training plane. So there's like no lumbar support on the right side whatsoever. I can't stand up in her. That's not going to happen. Once I'm in, I'm in. However, when I'm on like those longer cross countries that I'm doing now, I can absolutely see the plane, we're straight and level. I don't need to do anything. I can see that I can take my right arm in particular and reach it to the seat behind me, open up my chest. It's a little harder on the left, but I can do something to that, even a shoulder roll. I can certainly pretend like I'm getting a pie in the face and get my neck back into alignment because I know I slump. And I can certainly take my feet off the rudders and just pump my ankles and move my legs a little bit. I think there's a way to alter this no matter what kind of plane you're flying, because again, we are the machine that's making the machine move. So why wouldn't that just be part of our flows? So I might even put that on my checklist system for a cruise check right underneath, checking the mixture is leaned and that I'm on course and heading. I'm going to put in little Beth Wagner's movement medicine. So I want to take a little kind of pause away from kind of this stuff. And I just want to ask you this question because I've been kind of dying to know. I work sort of more in the therapeutic yoga realm. And I know that physical therapy lights you up. Obviously, it's obvious in all of your YouTube videos and the work we did together. What do you love about PT? What is the thing that keeps it from being a grind? Because any job can be a grind. But what are the moments you have, where you're like, that's why I do it? Why do you love PT so much?
There are a couple things for me. One, for my own life balance, is the variety. Variety is really key for me. I like changing positions, being in a variety of physical conditions, sitting, standing, moving. I like the variety of tasks. Every day is different, working with different people, doing different things. So I am exercising different parts of my toolbox every single day. So I like that. I think in terms of the work with individuals, what I really like is finding aha moments where things click for people. I love learning from clients and patients where we talk about concepts, just as we're talking right now. And someone says, well, you know what that says to me in my life is here's where I can take that. Here are the connections I think I can make that will help me. I love that. Those tend to last longer anyway when people come to their own conclusions and when things really resonate and stick with them. Those are the things that tend to be the best tools and to be the most effective and lead to the best outcomes.
That's really cool. Thank you. So most of us think of physical therapy, pilots included, myself included, I think, until actually, I started working with you. Like I was saying at the beginning when we started talking, like PT, you wait until you've got the frozen shoulder or you get a script from your doctor to go get PT. PT, though, can be, as we've been talking here, preventative strategies. What's the logistics of that, though? Can someone just do private pay? Because I just sent you an email like, hey, will you work with me? I want to just work on helping me not get motion sick. And I bet you're going to have a lot of good ideas. And we just I think we did one session and then we did some follow-up via email. Is that something that is available to people in general with PTs in their area? Do they have to go through insurance in their doctor? Because a lot of pilots may not want to go through official channels for things for lots of reasons. They might just want to do some preventative medicine. Is that possible? How does that work?
Yes, it's definitely possible. Physical therapists are licensed by the state. So we do pass a national exam, but licensure is by the state. Most states now do have direct access, meaning that physical therapists, we don't need a prescription from a doctor legally to work with a patient or a client.
Okay.
And so that is state dependent. The best place to start would be just to ask a PT in your area and say, are you able to take private pay? If direct access is available in your state, then it's up to the individual physical therapist as to whether they take private pay clients, if they only go through insurance. I don't know of anybody that wouldn't take a private pay patient, but that is up to each individual professional. And then it's a matter of connecting, with them and just asking, this is what's going on. I would like to come in, for these reasons. Now, also, I will say kind of the traditional view of PT as responding to, yes, the frozen shoulder, the car accident, the surgery, that really has changed over time. So even preventative care is really covered better now. So it's just fine if somebody does not want to have to go talk to their doctor and go through insurance. I get that. If you don't want to jump through those hoops and you just want to go straight to the source. Another option is just kind of a phone call to say, hey, I have some neck pain, I have some headaches, or I'm thinking I want to be sure that I am healthy. I'm a pilot and I want to maintain the health I have. I actually don't have any issues right now. I just want to maintain where I'm at. And I'd like some professional consultation about a wellness plan. Most doctors will have no problem signing a referral to physical therapy. And then when you meet the physical therapist, then it's your conversation with them. And it's up to you and the physical therapist to figure out where to go from there.
That's really cool. Thank you. I wasn't quite sure how all of it worked if you had to get a referral. And I think, again, I'm always encouraging myself and other people, prevention. And also, as you've been saying, get to know what your baselines are for all of these things so that as things change, as you get older, because they will, then you'll know what you're dealing with rather than waiting until it gets to be a real big issue.
Health for pilots is a very important, but also sometimes scary game for us. We know that depending on your age, you need at least one medical a year. The depth of that medical depends on sort of where your baseline is. But there's always that fear of, oh my gosh, like maybe something's going to happen and I'm not going to pass that medical, which means I can't do my job. In other cases, it's every 6 months if you're a little bit on the older side. So we're always looking at what can we do now to try to make things better, because sometimes going to the doctor is scary. Because even if I go to a regular doctor who isn't my flight physician, then just the act of going to that doctor means I have to tell my flight physician action. And if I don't, then I get into other trouble. So there's always that question in the back of a pilot's mind of like, okay, is it worth the risk of going to a doctor? Just in case, I'd almost rather not know and just deal with it. So there's a lot of different things that run through our minds when it's, okay, something might be a little bit off. I want to get it taken care of, but what are my options?
That's a great point. I was not aware of that. Totally makes sense. It may also be helpful to think of a physical therapist, again, if direct access is legal in your state, as a resource similar to a personal trainer, a yoga instructor, a coach, as opposed to a medical professional. And maybe that would, and that's, I'm not saying be dishonest, not at all. But if the goal is to maintain health, you ask a coach for that. You ask a personal trainer for that. So if that's the goal, I think that's honest. And so if you ask for, hey, can I have a consultation? I just want to share, this is what I'm doing. Here's my life. Can we, I don't know, run through just some assessments to see what I might be missing? What could I be doing differently in my own workout and health routine that could really optimize my health and my longevity and everything else? So I think that is a different way of looking at it. It's still very honest. I wouldn't think that would be like a reportable event, because it seems like that's more along the lines of health promotion, your workout schedule.
Education too. Like I look at the work we did together, I wanted to educate myself. Tell me more about the vestibular system. Brainstorm with me other ways. There's nothing wrong with it. I wasn't having any problems. I've never actually had to call any flight due to motion sickness or anything, but I just wanted to improve. So as far as I'm concerned, I'm like, that's just education. It is fine lines that we are, that we're walking here.
But if there's one thing that pilots love, it's preventative maintenance. I mean, we live and die by preventative maintenance, and that does 100% bleed into our personal lives when it comes to our cars and our houses and anything else that we work with. Like, it's always about fix it before it breaks. So I think it's important for the pilots that haven't thought about that with their body, that they probably should.
Absolutely. And PTs are an excellent resource for that. And we love that work. It isn't something that we kind of get to do very often. That's not what PTs are most known for, but it's fantastic. I love working with healthy people. And that also exercises kind of a different part of the toolbox. Absolutely. That's really fun. And then from there too, it's up to the individual and the PT to talk about, well, what does that mean? Is this a one time and then see where it goes? Is this an every 6 month check-in? Is it what is it? So that's fine. It's not up to a doctor to dictate how much therapy you need. It's up to you and the PT to talk about goals and create a plan that works.
That's awesome.
Another thing with posture that just struck me, and this could be helpful in a plane or anywhere, but it seems like there's so much vibration with a plane. As a passenger, when I get off a plane, I feel 2 inches shorter. So there's just so much vibration and kind of settling that can happen. And so as you're trying to move your spine in and out, the other component that's really important is to have the length to accommodate the curves. So another great thing to do for posture is imagining a string coming from the top of the head and just pulling up. And that can be helpful. And that can allow whatever little micro shifts need to happen in the body happen. So sometimes that will happen on their own. I've done that and felt little pops and little whoo, and I don't have to do anything else. My body knows what to do. It just needed the space to do it. So that's a great one. And that one is a split second and can be done in the middle of anything else. So when you're feeling that sense of being squashed, instead of trying to make these adjustments, the first thing is just get tall.
That's a good one for my flight instructor friends who've spent hours and hours in the pattern while students are trying to learn to land, and boof, oh, and then you really do feel 2 inches shorter.
Absolutely. And on the controls, the way you described the controls, John, being mostly in front of you and then also down, even the ones that are up, the thing is that, if you end up feeling squished like this and then you start looking up, that's just going to pinch through the back of the neck.
Yes.
So that idea of getting space, elongating the spine first, then moving around, it's much better. It took me a while to get to it, but there's your shortcut, John.
You are a puppet hanging by a string. La, da, 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 da. But it really does, when you find that right alignment, it really feels like the whole skeleton just finds where it needs to be. And around that skeleton, then the muscles can kind of relax. It's a very different sensation, and it does take training and time. But you think about a pilot who's compressing the lumbar vertebrae, maybe having issues with sciatica, which is when the pain radiates down that nerve on I believe it's the outside of your leg, right? You get that horrible nerve pain through the hip. Do I have it right? So everything's
through the butt, through the
butt. Yeah,
through the
painful.
Yep.
Painful. So getting those vertebrae lengthened and actually letting the cushions do their job, such a simple thing.
There's a few things that I do want to ask. I think that I would also love to hear a little bit more in relation to the spatial disorientation, a little bit of the motion sickness stuff too, because I know, Gita, you said you suffered from that.
Yep.
One of my first students, he had a lot of issues with motion sickness, which then again correlated into the spatial disorientation. If I did have him do unusual attitudes, that was usually when it made it even worse. So, I'd love to start out from the motion sickness side and how that links into the vestibular system and maybe give a little bit of an idea of what that looks like, because I know that even from the private pilot's level of certificate all the way up, the sort of aviation health focuses on that, but it's very knee deep. It doesn't really go into too much other than like you've got the arches and the fluid and the little cilia hairs and stuff, but I don't know if any of us truly know what that actually means. One of the things that we train for is what we call unusual attitudes. And so the way we teach it, especially from the lower levels, is just kind of lower your head, close your eyes, let go. And what this is doing is it's allowing for the inadvertent instrument conditions. So let's say you're a private pilot and you get into the clouds. Well, what that looks like is you just covered your entire windscreen with shaving cream. Like you can't see anything. And so you need to know how to trust your instruments, but your body's going to lie to you. And I used to get this quite a bit. I had to train myself out of it. When I would fly in instrument conditions, a lot of times I would feel, if I was straight and level, I would feel like I'm in a climb. And learning to go, okay, my body feels this, but my eyes are telling me that, I'm going to trust my eyes. And it's difficult. And again, some cases it sort of brings on a motion sickness feeling to some people. But the idea of the statistics from an aviation standpoint is that a lot of private pilots who find themselves accidentally in those conditions, the accident rate on that is quite high. And so as a system of training, we have really hammered on practicing that so that, God forbid it does happen, they can have the sort of skills in their toolkit to get themselves out safely.
Okay. Yes. And thank you for going over that with me too. That helps me answer your questions or suggest some things. So your question, I think, to start with the vestibular system and physiologically how we know where we are in space. Our sense of balance, of overall balance, comes from three different systems in our body. One is our somatosensory system, or what we feel. So when we're standing, it's what the input we get from our feet. When we're sitting, the input we get from our legs and our hips that go up through the spine, that tells us where we are and how we're moving, the speed of movement, the direction of movement. That's the somatosensory system. Also, proprioception is part of that. Proprioception is a sense in our joints about speed and angle of movement as well. And all of our joints have proprioception. The second system is our visual system, as you mentioned. So our eyes, same thing, tells our brain where we are, the direction of movement, the speed of movement. The third system is the vestibular system, and that comes from both inner ears. And it's a series of organs, a series of canals and various organs that provide that same information to our body about speed, movement, where we are, and then direction and speed of movement. So our brains put together all of this information to tell us where we are in space and where we're going. So you take away the sensory system, or it's not accurate because the plane is moving. So you still have feedback, and maybe it provides some information, but it's not the same as being on the ground on Earth, which is what we're used to. So that information isn't entirely accurate. And then you take away vision, or it's not accurate, and now we're left with the vestibular system telling us where we are in space. And in a vacuum, without other information, it's very difficult. So training, it is important to train up the vestibular system. So to go along with that, another thing you mentioned, John, is what you learned through training is your kind of sense, or a fault perhaps, of your sense of where you are. So when you don't have vision and your sensory system, you tended to feel like you were tipped back, or you were on an incline.
Kind of up to the left is how I used to feel.
Okay. And there could be a number of reasons for that. It could be differences in your vestibular system. So one side is stronger than the other. If one side is a little bit weaker, then the signals it sends to the brain can be slower or faster than the other side. So it causes a mismatch in information, and that can cause motion sickness. It can also cause vertigo. So vertigo is specifically the sense of spinning, and there are a number of conditions. So that's a whole different thing. I don't know if many pilots really experience a sense of spinning, or is it more just the motion sickness?
I'd say it's a lot more of the motion sickness. And I think, again, it's something you either have to overcome, or in some cases you have to find something else to do. You really can't be a long-term pilot and continue to suffer from motion sickness. It would just be extremely difficult and uncomfortable.
Yep. Okay. That's interesting that's the conclusion. From a vestibular training perspective, I would say it's also similar. Vestibular rehabilitation, the research shows that vestibular rehab exercises are really not very helpful for pure motion sickness. Now, with that said, I think exposure training is really important. So just doing it over and over and over again. I think nervous system regulation is really important, so that you can be present with yourself in how you respond to that feeling. It's multiple steps. There's a sense of and then there's our body and our brain's response to that sense of that tends to exaggerate it and make it much more severe, much more uncomfortable, much more worrisome or problemsome than it maybe needs to be. So part of training and exposure training is also that nervous system regulation to try to decrease the reaction to the physiologic experience. Some people probably are doing that already in training, and that can come simply from your pilot coach or instructor saying, "You're okay. Just keep going. You're okay." That's basically it. You're okay. Just keep going. You're safe. It's going to be okay. In a nutshell, that's nervous system regulation. Some specific kind of tests and exercises that I was thinking could be helpful in addition to the specific training that you guys are already doing, but things that people could do on their own for additional exposure training, additional information that they can also be kind of in charge of or in control of. So one is to stand in front of a mirror with that upright posture, thinking of the string, getting real tall, and with neutral alignment. So meaning checking your feet, that you're not standing on one leg or another, but you're really in the middle for you. Have your arms relaxed. Don't be touching anything. And then look in the mirror and notice the alignment of your face. Notice your forehead, your eyes, your nose, and your mouth. Are you basically even? Are you rotated? Are you tilted? Are you looking up or down? And just note that, and then try to start in the middle. Then with your eyes open, turn your head to the right and to the left 5 times at just a medium speed. Not slow, not fast, just 5 times back and forth. And then stop in the middle and look at yourself in the mirror again. And just notice if your alignment is off. Has it changed at all? You might also notice if you get a little spinny or a little motion discomfort just from the head movements. So that's the first part. The second part is to close your eyes. So now we're taking vision out of it. Same thing, 5 head turns side to side, medium speed, and ideally too in a quiet room so that you're not getting auditory information about location or where anchoring. So you're not getting any auditory anchoring. So eyes closed 5 times side to side, and then still with your eyes closed, come back to the middle, pause, and then open your eyes. And then notice. So like in your example, John, when you come back to the center, is your chin up a little bit? Are you tilted up? Are you tilted down? Rotated left or right? So that's one thing. It can be an exercise in and of itself where you just do more repetitions, you adjust the speed. It can also be something that if you notice a certain angle adjustment, it can give you some information about your body. Maybe there is a neck alignment issue that could be addressed. Maybe there's some muscle imbalance issues, some tension that could be addressed in any number of ways. Maybe it's also a thing of attention, of mindfulness. So if you notice a certain angle, do it again. See if you can change it just mentally by noticing it. Do it with your eyes open, do it with your eyes closed. So that's one thing that can be used as a self-awareness assessment and as a tool, as an exercise. And then another one that takes it a little farther down the body. So that first part does give some information about tightness or alignment in the neck and vestibular system. Second one is to stand on a floor that has lines or some kind of texture where you can orient your feet to kind of neutral. So your feet are in line with the texture of the lines on the floor. And then with your eyes open, looking ahead, step forward with one foot and then back. Forward with the next foot and back. Keep alternating, stepping forward and back, looking forward. So you're just going forward, back, 5 times. And then stop, look down at your feet and see if you're in the same place. Have you rotated? Have you shifted left or right? And then eyes closed. Close your eyes, same thing. So line up your feet again, close your eyes. And now 5 times you're stepping forward and back. Again, medium speed, stop, open your eyes, and then look at your feet again. And that can give some information about tightness or muscle imbalances all the way down to the ankles even. And all of that could affect a pilot's sense of where they are in space when you take away vision. So it can provide some information. It's a good time then to check in again with the body. And this gets into a whole host of other things of awarenesses, injuries that could have some lingering residual tightness or malalignment involved that could be addressed, could be beneficial, even if they're not painful or otherwise problematic. If it's affecting where your sense of where you are in space is, it's going to affect, I would think, your pilot skills. The other thing I just wanted to mention, of course, is just that vision compensates for these areas. So for most people, most people will feel a difference doing those 2 exercises with their eyes open and eyes closed. It doesn't mean they're going to be off necessarily, but it's going to feel different. So it's also a way to practice and experience that sense of motion with our eyes closed, because most of us don't spend much time doing anything in our life with our eyes closed and feeling what happens in our body until you get into an exercise like what you're talking about. And then it's pretty loaded. So another benefit of this is it kind of helps to normalize it. You're doing this exercise in a very low stress, no stress situation, not with a pilot instructor looking over your shoulder. So it gives you a chance to really check in with your body, notice what's happening, see if something needs to be addressed. And if not, it's just exposure training. It's just, hey, this is what it's like and it's okay. This is just what it feels like. Woo. And it's all right. So it also helps for nervous system regulation.
And I can completely vouch for all the things you're saying actually really, really do work, because I did your beginner vestibular program, then I did the second one. I would take them in the woods and I would do them while I was walking, the head turning. I must look like a crazy lady walking through the woods with my dogs up and down hills and shaking my head to the side and doing diagonals, doing whatever I could to literally induce the feeling of dizzy motion sickness for 2 reasons. Number 1, to stimulate my system again. John, you've been flying since you were in college. I haven't done anything like that, like ever. So to my system, it was like overload. So I thought, well, let me do as much as I can on the ground. So I would take all of your exercises, Beth, and then take them out into the world and do them in the car while hubby was driving. I would go to the gym and stand on one of those. It looks like a Swiss ball, but what's it called?
A half moon? Bosu ball. The half moon ball.
Yes, it's like a half moon and it's just filled with air. You try to stand on that thing, holy moly, then stand on it and close your eyes while doing the vestibular training that you have. I mean, I was doing anything and everything I could, as well as flying as much as I could. The other day, my instructor and I went out and we did steep turns and turns for like 2 hours. And I had not one even moment where I was like, oh no, I'm going to get motion sick, because I like decoupled that feeling of all this stimulation from flying with that like anxiety response of I'm going to get sick. And I know, again, at some point I may get motion sickness and it's okay, but I no longer have that like knee-jerk reaction in my nervous system of a lot of motion equals anxiety, then equals motion sickness. I've managed to decouple that largely by following your work and then being the crazy lady walking through the woods, shaking her head all around. But I love this idea. Just playing. Like we as adults, I'm talking to my midlife pilots here, especially if you're someone who wants to do aerobatic training. I was talking to an aerobatic pilot. He said, I have horrible motion sickness. He said, every time I have to go and do training flights slow and steady, start with 20 minutes, then do 40 minutes. And he's like, and then I can build it up again. He said, but if I step away for a month from training, I have to kind of start back again and get my system used to it. But there is hope. I would say there is hope for people.
Well, that lends a question. Does it get more difficult with age? I mean, I've heard of like your vestibular system sort of crystallizing and stuff. Does that make you more susceptible the older you get, or is it just kind of more of a person to person sort of thing?
Yes and yes. So the statistics are that vestibular issues and like positional vertigo, BPPV, are more common with age for sure. And just because of wear and tear on the body with age. With that said, I've worked with people in their 20s with BPPV. I've worked with people in their 70s and 80s who told me they had an issue in their 20s and never had it again. I've worked with people with chronic vestibular issues. So it really is across the board. So just because you have it, yes, statistically, one would say, okay, well, now that you've had it, you're more likely to either continue having it or have it again. But that is not a guarantee. And I would not recommend somebody to put that on themselves. Really good question. And I agree that there definitely is hope. It takes time, training, and practice, lots of practice. And I think that awareness and perhaps dedication with what the gentleman, you mentioned, Gita, he's learned if he wants to continue doing acrobatics, he just has to build that into his schedule then. So he knows if he's taken time off, he has to do the 20, 40, whatever that is, and probably each time have a little bit of grace and patience with himself that, well, maybe I should save a couple days or book an extra practice session. I don't know how that works. Just in case I need even one more. And so just to take the stress off of that expectation and kind of be ready and be flexible with it. Yeah. And then really play with it. One of the things Gita and I talked about too is that idea of play and variety of exposure. So nothing is quite like flying except flying, of course, but the more variety and different ways you can move your body, move your head, your body, and relative to gravity, and find ways of minimizing gravity is going to be great. So in terms of other things to go along with like specific exercises, when people ask, well, what are just the best overall wellness or forms of exercise? I would definitely say yoga. And I swear Gita did not pay me to say that for many of the reasons that Gita's already mentioned during this podcast. Yes, so that the movement, the coordinated movement, the differentiated kind of movements, so the rotational movements, moving one arm and one leg in different directions, just all of the things involved with yoga is fantastic. Also the gravity minimized, so the inversion positions in yoga, the elongation focus in yoga, the breath and attention and mindfulness focus in yoga. I think those are all really beneficial components. Another is a Tai Chi or Qigong for that balance work. Also that sense of awareness, of body awareness, where you are in space. For conditioning or cardio, I suggest walking and swimming. Swimming especially because of the gravity minimized. So the ability to get some spinal rotation without the compression through the spine. The ability to get hip extension, to be able to stretch out the hips, and then resistance training for sure. So spending some time in a gravity minimized position. I don't know if that physiologically has an effect. I would imagine far less than like space travel, but spending a career in the air, I'm not sure if that carries any risk, but it makes sense to me to balance that out with resistance training. And then I would not recommend biking, actually, because of the position. So sitting all day and then sitting on a bike, leaning forward with your chin up, I think is not great. If someone is an avid cyclist and they love it, by all means, go for it. But if someone is looking for conditioning and exercise, I would not, that would be on the last thing on my list. And then also in terms of kind of play and fun, I would encourage things like climbing walls, so getting kind of up in the air, some belay work. So getting even that little bit of a free fall, I think is helpful. Things when Gita and I talked, I shared with her, I've done some trapeze flying and it is so much fun. So if there are any circus schools in an area where you live, they have trapeze flying classes and it is an absolute blast. So learning to do flips, jumping off a platform, which for me it took me forever just to step off the platform. But the first thing they do on the trapeze bar is go up, get your feet up on the bar, and then hang your head, and then come back up and do a flip to dismount. So the first day after an hour class, I had done that 3 or 4 times, and my abs were in excruciating pain for days, and my arms and my lats. Amazing workout. So I think get creative with whatever time that you have. If you're flying in different parts of the country and you feel like stepping outside the box, check out random programs like that, climbing walls, trapeze, Tai Chi, Qigong, and, take a class in a city you're visiting. It's also a really great way just to reset, shake things up.
I don't know if this is a dumb question or not, but from a nutritional standpoint, is there like a nutrient or a food that you can eat that would be beneficial to, say, your vestibular system? Or is that just kind of, if your overall body is healthy, your vestibular system is healthy?
I would say overall body health. Hydration is certainly key. So hydration and electrolyte balance is really key. For some people who've been diagnosed with Meniere's, they're put on a low salt diet with the idea that salt affects the fluidity in the inner ear, and that makes Meniere's worse. I've also seen that debunked, and many people with Meniere's don't notice any difference following a low salt diet, but I thought I would mention that because that is still standard intervention at this point. But overall hydration, electrolyte balance, and then just, overall balanced nutrition.
No shortcut, John, but we are going to take a Calm Cockpit field trip, and we're going to find trapeze and do it together.
I would do it.
Let me know. I'll meet you there.
That'd be so cool. Was there anything else, Beth, that you were like, I want to make sure that pilots know about this or that?
I would say I mentioned briefly doing things with your eyes closed, specifically standing on foam, pillows, even soft towels with eyes open, and just noticing the balance challenge, and then closing eyes can be very helpful. And then also standing on one leg with eyes open and then eyes closed. And then if it's safe, for each individual has to decide, of course, has to try these out and make sure they're safe for them. But standing on one leg on foam with eyes open and then eyes closed. If you've had an ankle injury as a kid or something, PTs will often do this with athletes, and it's amazing. People will be an athlete, can be back out on the court or out on the field and say, I'm fine. And you ask them to stand on their unaffected leg with their eyes closed. It's, again, a young athlete, and they look at you like, how easy is that? And they're fine. They're solid. Ask them to stand on the injured leg, and it's oftentimes very difficult to maintain their balance. And they're shocked, because they've been out doing their sport. So it's just an example, but for a lot of people, again, it'll give the individual some information. Do I have some residual maybe stiffness or weakness from an old injury? Or is there something, going on with me? It's also just great practice for tuning up the vestibular system. And then if someone is having a hard time trusting those instruments, there may be something that you could do to incorporate. This is more out of my wheelhouse, but maybe John and Gita, this makes more sense to you. But just some things people can do at home even. So setting up some fake instruments or something and doing some of that work. Or, have somebody adjust the instruments to show something different than what is accurate, and then standing on one leg or moving your head around, and then opening your eyes and focusing on those instruments. So I think that could have some merit, could be helpful.
It absolutely does. I actually have a poster of my cockpit, dashboard, for lack of a better word. And I'll do some of those vestibular things, basically try to throw myself off balance, right? Just try to make myself dizzy and whatever. And then I just open my eyes and try to train my eyes to go where I want them to go, which is, attitude indicator, airspeed, and just get my motor system trained so that even if I'm feeling, completely dizzy, that my eyes know where to go, so that then I'm not also searching with my eyes. Those instruments don't move, but I at least try to functionally train, again, that auto response to be like, this is what I do when I'm feeling disoriented. I think we're great minds think alike. No, you have a great mind and I am following in your footsteps, but I think the creativity is there. And I think pilots listening can think about what is their situation, what are they trying to work on? And I want to challenge every pilot listening right now, stand on one leg, on one foot, whatever, stand on one leg and close your eyes and see what happens. And see if you can hold it for a full minute even, because you'll be like, oh, it's easy. Okay. Keep holding it. If that's easy, try it on foam. You'd be amazed, even if people don't have injuries, how many of my yoga students come in and like, oh, that's fine. And then boom, they're like, oh my gosh, I almost fell. Or having one foot directly in front of the other and then close your eyes. It's absolutely amazing. Again, athletes, people who think they have great body awareness, very often are humbled by that. So I would encourage every pilot to try that, because you can correct these small imbalances on the ground. And then when your feet are on the rudder pedals and you're in a moment of spatial disorientation, you will at least have more awareness of your body and your nervous system so that you can manage and direct that situation. So I think, Beth, everything you're offering here is just gold. And I hope people can kind of take it and create their own little exercises. We're going to have pilots in gyms across the world doing all kinds of things. John, were there any other questions before we kind of lead towards wrapping up?
I think that is the extent of my questions. I really appreciate all of the advice that you've given, and certainly it helps educate us on what's actually going on, but also gives us some of those actionable strategies. So that's kind of right up our wheelhouse. So we really appreciate you taking the time.
Oh, fantastic. Well, good. I'm glad this was helpful. And thank you so much for having me. I really enjoyed it.
It has been a treasure trove of information. We really appreciate it. Thank you.
Well, that interview had some really great stuff in it, and we're going to make sure that we put some very robust show notes into this episode so that you can see just the plethora of all of the things that Beth talked about today, because so much of it links back to her YouTube channel and some of the other resources that she has. So make sure, if you don't normally check show notes, I think this is one where you should go the extra mile for. And Beth actually reached out to us and just recommended, she said that there was a few videos specifically on her channel that she thought would be helpful to us and to all of you. And so the four that she really thought would resonate with you involved the foam roller spinal alignment, body scan relaxation, progressive muscle relaxation, and the eye massager review. So make sure you go ahead and check those out. And again, those will be included in the show notes.
I tried one of the exercises she mentioned where she said, stand in a place where there's a carpet that has lines on it that you can line up with, and then take a step forward with your right foot and left foot, and then step back with your right foot and left foot. So you're just basically stepping forward and back on the same spot. And then do that with your eyes open, no problem. I did it with my eyes closed, and I was turned to the left after like 4 steps back and forward. And I was convinced I was pointing forward. So then I did it again, really concentrating on stepping forward and back in the same plane. And I was still to the left, but much less to the left. By the 3rd time I did it, I was able to do it and maintain my body in that core alignment. Which, just with that little simple exercise, it was like, I think this stuff is really good for the brain and body, of being able to reorient yourself quickly without always relying on all of the visual cues. I think the more robust we can make our brains, the better. And I just wanted to challenge pilots just to take one little nugget from today. And that's where John said, go check out those show notes, because for everyone, it's going to be something different. But just take one little thing that resonated with you today, check out one of her videos and get using it today, because you got nothing to lose. And normally in show notes, we give like a lot of summary, but today I wanted to talk specifically to my midlife pilots, and a shout out to the Midlife Pilot podcast, which I love, and I'm a member of their community. They had an episode number 151 where listener and community member Chris T wrote in about motion sickness and his desire to follow his World War II pilot grandfather. And they had a really great discussion about, like, how do you get over motion sickness? Can you be a midlife pilot if you have it? And I've been chomping at the bit to talk to them about it. And the timing worked out that we happened to be recording this episode. So I look forward to sharing that with them and speaking hopefully with Chris T about how his training is going, and give you hope that if Bob Hoover can get over it, you can too. So very thumbnail sketch version. At some point, we'll do a longer, deeper dive into motion sickness and probably bring on some other experts. But just what I've done in a thumbnail sketch to give you some ideas and how I integrated Beth's work. My fear of motion sickness began probably with turbulent commercial flights when I was a musician flying. I was often in the back of the plane. Hello, musician flying. Perhaps on some of those flights, I was a bit dehydrated. Perhaps there had been alcohol consumed the night before, right? But landing in Chicago, near blizzard conditions, bumping around in the back of the bus, hungover. You can guess what happened. I got sick. But it started to become this thing that I believed about myself. I'm just a person that gets motion sick. And then I didn't even think that flying could be for me until I really started to challenge that thoughts are not facts. And just because you have a body sensation doesn't mean that that's going to be your response all the time. So I did a physical addressing of the issue, and then I did a mental addressing of the issue. A lot of the fear was fear of being motion sick was tied up with my fear of flying, fear of loss of control, my self-doubt. Can I handle this thing? Will I be able to do it? Can I really be independent in that way in an aircraft? So I worked on that with a lot of positive self-talk, actually recorded positive self-talk messages into my voice memo and listened to them every morning when I'm feeding the dogs. It's just become an automatic. I'll link the work of Shad Helmstetter, who has tons of books on how to develop self-talk scripts. They're really, really positive. I also did the mental work of educating myself about how other pilots like Bob Hoover handle motion sensitivity. And I read research by the Navy and the Air Force about how they train their pilots to gradually desensitize to the environment. So I started to see that it's not a flaw. It doesn't mean you can't do it. It's just being a feature of being a human being who we are not designed by nature to be airborne, but that I could learn with exposure and time how to manage my response. Then the physical stuff is really where Beth came in. The number one is flying as much as possible. It's as much as time as I could get in the air, the better. Even those flights where I started to feel a little motion sick and just told my instructor, hey, starting to feel that little tickle on the back of the neck, we just fly straight and level. I'd have a peppermint, relax for a minute, and then we got back to the flight. I never vomited or had to end a lesson early because of the motion sickness, but I spoke up as soon as there was the tiniest hint of it happening so that it didn't become this then like fear response and anxiety response, which then just forget it. Then you're off to the races once anxiety takes over. The physical stuff I did on the ground though, and this is where Beth's work comes in, I did two things. One was to actually induce disorientation and then learn how to come into recovery from being disoriented. The other one was to induce disorientation and stress, but maintain neutrality the whole time. So I wanted to do train sort of both facets of my brain. So I would induce disorientation by taking her vestibular rehab exercises kind of to the extreme. Like I'd be on a swing set and doing her eye movement exercises while I was swinging up and down. I'd have my husband drive in his truck on a really bumpy road while I was looking backwards and up, and then do a lot of the head turns that she suggests until I would get to the point where I actually felt dizzy or lightheaded or just like I couldn't quite make sense of if we were going forward or backward, and then I would instantly sit and have something predetermined that I was going to fix my eyes on and say, there's my attitude indicator, there's my altimeter, there's the vertical speed indicator, what are they saying? And would just do that over and over again to see if I can just get myself used to feeling disoriented and then come back into what are you going to do next? What's now? And I still do that because I think I still have some work to do. The last one is that inducing stress, but maintaining neutrality. So instead of taking myself to the point of being like completely dizzy, I would try to induce outside stress. So anytime I was working out, I love to lift weights and I work out hard with weights because I'm trying to get this midlife body into some shape. So I'd wait until my heart rate was like at max and I would feel like all I could do was just breathe. And then I would do some of the vestibular rehab exercises while doing slow, relaxed breathing. So I was never getting disoriented, but feeling stressed, but then asking myself to do like the first emergency action items and just gradually move that line forward. So kind of trying to increase like my tolerance for like when the stress response will really kick in, while also knowing that if it does kick in, that I know how to bring myself back. I think there's a lot more to cover with that. I just want to give people hope that don't just think because something happens to you once or twice or even 10 times that that's how you have to be. And I think that's the essence of Beth's work. It's physical therapy. It is designed to get you back to your balance.
And if all else fails, one of the things that I did as a kid that turns out I think benefited me in the future, over Labor Day, my hometown would have a carnival come in. And me and my best friend had essentially a goal where we would spend the day at the carnival and whoever pukes first loses. And I am the reigning carnival champion because there was not a spinny ride that I could not handle. So who knew I was training to become a pilot in my my early teens by taking every spinning ride possible.
I love it. John, if you and I ever go to a carnival together, you will definitely win because those spinny rides, they get me every time. And in fact, Bob Hoover said at the end of that interview, which I'll link in the show notes, that he's like, even to this day, he said, you put me in the back of an airplane in the back seat. He said, look out, I'll get sick. And I was just like, praise Jesus. If this is Bob Hoover, I can do this. I can be a pilot, and you guys can too. So much great stuff in this one, huh, John? I think it's a lot to pick apart for people. We hope you find what resonates. Can you please tell the people what else they can do to support the Calm Cockpit?
Yeah, of course. If you are enjoying the episodes that we're putting out, or frankly, even if you're not, we'd still love to get a message from you, calmcockpit@gmail.com. We'd also love to get a review. You don't even have to put a written review in. Just give us some stars if you could. We'd appreciate that. It helps us get a larger audience, find more people interested in becoming better pilots and better human beings as well. So with that, fly smarter.
And stress less.
Boston Tower 1 departure is Airbus 321. Traffic holding crossing runway 33 left, 3 lane.